It sounds like science fiction, but new research suggests that light, when combined with nanotechnology, could offer a powerful way to target cancer cells while leaving healthy cells unharmed. Cancer treatments like chemotherapy and radiation often affect both cancerous and healthy cells, leading to serious side effects and strain on patients. Because of this, scientists are constantly searching for therapies that are more targeted treatments that focus only on the tumors. In a study published by ACS Nano, researchers explored a light activated therapy using LED diodes and microscopic tin oxide nanoparticles. These particles, described as nanoflakes, are thousands of times smaller than the width of a human hair. At these scales, materials can behave very differently, giving scientists new ways to interact with cells at the molecular level. The tin oxide nanoflakes used in the study were specifically engineered to respond to near infrared light. This type of light can safely penetrate skin and tissue more effectively than visible light. This figure illustrates how tin oxide nanoparticles are produced and used in this particular therapy. Bulk material, which in this instant is tin metal, is electrochemically exfoliated to produce ultra-thin sheets, which will later be delivered into the tumor tissue. When exposed to near-infrared light, these nanoflakes convert it into heat, selectively cooking cancer cells while sparing healthy tissues. The result is efficient tumor destruction through localized photothermal therapy. In laboratory experiments, these results were striking. After just 30 minutes of LED treatment, nearly all skin cancer cells were eliminated. For colorectal cancer cells, about half were destroyed under the same conditions. Figure 8 shows the evaluation of the anti-cancerous activity of tin oxide using A431 human epithermoid carcinoma cells. After incubating the cells with tin oxide for 24 hours, these samples were either exposed to IR light or kept non-irradiated, followed by life or death assay. The fluorescent images revealed that IR irradiation greatly increased cell death, especially at higher tin oxide concentrations. Quantification confirms a significant reduction in cell density under NIR, demonstrating the strong photothermal enhanced cytotoxic effect of tin oxide. Just as important, healthy skin cells exposed to the same treatment showed little to no damage. This selectivity is one of the most promising aspects of this research. This treatment strategy is known as photothermal therapy. The idea is simple but powerful. Deliver heat exactly where it's needed and nowhere else. Photothermal therapy isn't entirely new, but what sets this research apart is the use of LED lights instead of high powered lasers. Traditionally, photothermal therapy often relies on lasers, which can be expensive, bulky, and difficult to control. LEDs, on the other hand, are more affordable, widely available, energy efficient, and easier to regulate. This could make future treatments more accessible and easier to integrate into the clinical setting. Another advantage of tin oxide nanoparticles is the relative stability and the low cost compared to some other nanomaterials currently being studied for cancer treatment. If further developed, this technology could open the door for treatments that are not only more targeted, but also less toxic and less invasive than many existing options. However, it's important to keep the expectations grounded. These results come from laboratory studies conducted on cells, not from clinical trials in patients. Before this approach can be tested in humans, researchers must determine how these nanoparticles behave inside the body and how they will be delivered to the tumors, as well as how they can be safely removed when the treatment is done. Even so, this research highlights the growing role of nanotechnology in modern medicine. By engineering materials on a nanoscale, scientists can design treatments that are interacting with the body in highly specific ways. By combining light, material science, and oncology, researchers are moving closer to cancer treatment every day. Treatments that are more precise, more controllable, and more patient friendly. While more research is needed, this study offers a glimpse into the future where fighting a cancer can be one day as simple as flipping on a switch.